We know that some people have been receiving steroid cards for their inhalers when they weren't expecting them. Could you tell us what they mean and why people might be getting them?
So yeah, steroid cards are not a new thing at all, but what's changed is the guidelines about when we give them out. Steroids are used really commonly in medicine to help treat some conditions, especially ones that cause inflammation. They're an essential part of treating some people with respiratory conditions as well. So people with asthma, some people with COPD need a steroid inhaler to help keep on top of any inflammation going on in their lungs. What we do know, though, is that for people who are on higher dose steroid tablets or they're taking very high doses of inhaled steroids, the body responds by shutting off its own supply of steroids. So the body makes its own natural steroids, and the medicines we take are just copies of that. Right. And the body recognizes when there's high doses of steroids in the body and doesn't produce any extra itself. That's not a problem, because when we stop it, then starts making it again over time. However, if you're on high dose steroid tablets or high dose steroid inhalers and stop them suddenly, the body can go into a bit of a crisis. And because there's not enough steroid going around, it can even be life-threatening for some people, and the body really starts to panic and struggle. The reason we give out steroid cards is that, let's just say you took steroid tablets and were involved in a car crash, for example, and you went into A&E, they wouldn't know you're taking steroids. And because you were missing the steroids that we're prescribing you, and your body's not making enough steroids at the moment, your body goes into shock at the same time as trying to deal with an operation, with the trauma and all the other things that are going on. And it's really important that the medical team can see that card to know to give you extra treatment to keep you safe and alive. The other thing is if you're taking, whether it's high dose or normal dose steroids as an inhaler or tablets, as you've been prescribed, you must take them regularly. You must do it exactly as it's on the prescription. And certainly from time to time, I see people who are worried about the effects of steroids stopping and starting their medication because they want to reduce the effect of them. The downside to that is it means their body is more susceptible to feeling unwell, to actually needing steroids to try and get better. So it's really important, if you're taking something regularly or it's being prescribed to you, you keep taking it as prescribed. What I would say is if you've had a steroid card, it's there for your protection. So carry it with you, carry in your wallet. Make sure that people around you know that you're on steroids as well. And if you're not sure whether you should have a steroid card or not, next time you're in your pharmacist or with your GP or with your respiratory nurse, have a chat to them and see whether you need one or not. But they're generally reserved for people who are on higher dose steroids for several weeks at a time, or on a very high dose of inhaled steroids for a long period of time as well.
With the vaccine rollout gathering pace, we know people might be wondering what happens when they get theirs. So could you guide us through what people can expect on the day, please?
Well, first thing to say is that people will be invited for their vaccine. So they'll either be contacted by their GP or they get a letter from the NHS. I will just I don't want to scaremonger, but just to warn people, there are some scams out there at the moment. So whoever you're contacted by, nobody should be asking you for any money or bank details. So if there's anything like that, then delete it and ignore it. But you should know if it's from your GP or from the NHS. When you do get that invite, you might get the option of having your vaccine at the NHS vaccination centre near you or with your local group of GPs. It doesn't matter who you go with, and some people choose to get it done as soon as possible, and some people prefer to wait for their GP's practices to do theirs. But it's completely up to you. But as I say, at the moment, people are generally going for whatever comes soonest. So on the day itself, if you've got symptoms that might be COVID, please do not come for your vaccine. You will be told book a test for COVID, and you'll be given another opportunity to book for your vaccine at a later date once you know the result and once your isolation period is done. If you are self-isolating, you must wait until after your self-isolation period before coming for your vaccine. Don't be tempted to come early. We don't want COVID spreading among the people who are waiting for their jabs, and you will still get your turn. So don't be afraid to just wait till everything's over and done with. If you have had COVID, we are advising people to wait for 4 weeks afterwards, and that's almost so that your immune system can recover and you get the most benefit from the vaccine when you do get it. When you attend on the day, you will be expected to wear a mask if you can. Follow the instructions that you're given on the day when you turn up, and there's usually people signposting you to where you've got to go and where to wait. And things like hand sanitizer and things should be available as well. Somebody will be asking you questions just to make sure that the vaccine is okay for you on that day. So that they'll ask you whether you're part of any COVID trials, because some people here will have had a COVID vaccine already but not know it. Some people we will ask about whether they've had any serious allergic reactions. Again, this is so that they're not given the vaccine when it might be unsafe for them. We ask everybody about whether they're on any blood thinners. That's drugs like warfarin, edoxaban, rivaroxaban, apixaban. And the main reason for this is that some people might bleed after the injection, or they might have a bruise at the site of the injection, which is sort of expect, but it's just something we do warn people about.
So we know a lot of people might be quite stressed and anxious at the moment. Can stress be a trigger for some people's lung conditions? And if so, what can they do about it?
Mental health issues and stress go hand in hand with people with long-term conditions like respiratory problems. And it goes both ways. So people who have got a long-term condition, whether that's asthma, COPD, bronchiectasis, fibrosis, lung cancer, they can struggle because of the impact of the disease or their medicines on their life, how it affects the people who are around them as well. So it can make people low. And actually having a respiratory issue, especially at the moment, makes people worry. They worry about the effects of viruses and catching it and what that might do if they end up in hospital. So absolutely, having a respiratory condition is meaning people are more worried and are developing mental health issues. On the other side of it, though, having anxiety, stress, or low mood can also affect people's breathing. So people who are more stressed are more likely to have abnormal breathing patterns. They're more likely to be tense. People with mental health issues are less likely to remember to take their medicines regularly or correctly. And we do know that people with stress, anxiety, depression are more likely to get chest symptoms, especially in conditions like asthma. So what we tend to advise, what I advise people to do is to maybe keep a bit of a diary to see if there's a link between how they're feeling and what their physical symptoms are, to find time every day to make sure that we relax and switch off. So that might be listening to music, watching your favorite TV program, doing yoga, mindfulness. And I know we've done some brilliant webinars on that as well. But first thing I do is actually visit the Asthma UK and BLF web pages, and maybe even both of them, because they've both got different hints and tips for people with respiratory conditions, and about how to feel in control of your mental health, but also some simple things that you can do to get on top of it. And don't forget also that your GP is there to help you as well. Make sure you make contact with them early to get help. Sometimes we do prescribe medicines, but usually it's about making sure that you get the support you need, even talking therapies, or just signposting to websites and things that can make a massive difference. So talk to people, talk to friends and family, speak to your GP, have a look at those websites. There is so much out there to help you, so definitely don't suffer, and don't suffer alone.
What can people do to prepare themselves if they know they usually get hay fever? And how can hay fever affect you if you have asthma or another lung condition?
Okay, so there's a few things in there. All the way through the year, there's different sort of pollens being produced by different trees and plants and weeds and things like that. But most people notice sort of around springtime that they become sensitive to sort of pollens that we see sort of coming out now. And it affects people in different ways. The pollens are sort of in the air where we can't see them. And most of them get sort of in through the nose, which causes swelling in the nose, mucus, tightness in the nose, and inflammation in there. That can cause people to sneeze or have runny nose and so on. But also those pollens can be breathed in, so they go directly into the chest, and they cause exactly the same symptoms there. So swelling, tightness, inflammation, mucus production, and rather than sneezing, it causes coughing there. So that's how pollens can affect different airways. Some people get hay fever without having asthma, and some people have asthma without getting hay fever. But for most people, I think it's important to try and treat it as one airway, so the nose and the air and the lungs being sort of linked together. And When somebody's exposed to pollens in the air, it can cause those symptoms of coughing, wheezing, or sneezing, and things like that. And that can make people breathless and even set off asthma attacks for some people. So this time of year, we encourage people who've got asthma to obviously be taking their preventer inhaler all the time anyway. But if they know that hay fever is and pollens are one of their triggers, either through their nose or through their lungs, then we encourage them to 3 or 4 weeks before the hay fever season start taking some preventer medication purely to try and stop the hay fever. So in terms of preventer medication, I'm talking about antihistamines, I'm talking about nose sprays, and things like that, and speak to your GP, your asthma nurse, or your community pharmacist who can help you with this. So we're seeing pollens coming up at the moment, so I'm really encouraging my patients to sort of speak to us and speak to the pharmacist about getting the right medication for them and starting it now.
The final question is, what would be the best piece of advice you could give to those people who've had their COVID-19 vaccine already?
So there's lots of chatter around vaccines at the moment, and the things I keep going back to the basics. So the government's main priority is to get everybody vaccinated as quickly as possible, and they're certainly on track to do this. Many millions have had their first jabs. Many people are now getting their second jabs as well. There have been issues with prioritization, so people at greatest risk of death from coronavirus, so higher age people and so on, that they've been sort of put through first, but everybody's going to get their jab soon. And the thing I'm pointing out to everybody is that both the first jab and the second jab are doing dramatic things in terms of reducing people's chances of getting severe disease or dying from COVID. And that's really important, not just for the individuals being protected, but for society and for the NHS as well. We're now learning that the vaccine is very good at helping to reduce people from catching it at all and from passing it on to other people. Everybody's going to have a slightly different response to the vaccine. So some people are very well protected, some people are a bit less well. But for everybody, I think it's worth just remembering that it doesn't 100% reduce your chance of catching and carrying it. And this is important for you. It's also important for the people you come in contact with. There is still a lot of COVID out there in the community. Numbers are coming down dramatically. If you see the government briefings and the news with all the things, the charts are showing it's all going in the right direction, but levels are still higher than they were last summer. So lots of people are still carrying coronavirus, and that poses a risk to people. A combination of reducing levels ever further and the vaccination program is our passport to getting back to normal. So what I'm saying to everybody who I'm giving the jab to, and that's many, many thousands of people now, is whether you've had one jab or two jabs, keep following the rules. So the government rules around lockdown, they need to be followed to help prevent the disease being spread around the community. We still need to be following hands, face, space. And I think this is going to go on for a long time, not just to prevent COVID transmission, but other viruses and infections as well. And it's important if you do get any symptoms that look like coronavirus, so a new persistent cough, a high temperature, or loss of taste and smell, then it's really important that you isolate yourself and arrange to have a formal test with the NHS. Keep taking all your medicines as prescribed, and by doing these things, we can keep you well. We can stop the little bits of coronavirus that are in the community spreading, and we can keep protecting the people who aren't 100% protected by the vaccine, and those people who, for whatever reason, cannot have the vaccine. So for now, even if you've had one dose or two doses of the vaccine, be patient. Everything is heading in the right direction, and soon we will hopefully be able to get back to some normality. So it's really important to keep following the rules for now, which isn't great news, but I think there is a lot of hope there for the sort of months ahead, so we can all start to see family and friends, start to do the things that we're missing, and hopefully start to have some things to look forward to again.